Welcome to the Rebel Health Coach Podcast with Tom Underwood. Armed with truth and knowledge, your journey to a healthy lifestyle can be obtained. Preventative wellness, quality nourishment, and daily fitness routines dramatically improve your outlook on life as a whole. And you'll find the support and info you need to accomplish a healthier lifestyle here. Together, we can empower each other along our journey to an amazing you.
Good evening, good morning, good afternoon, whenever you may be listening to this episode of the Rebel Health Coach Podcast. My guest today is Dr. Millie Lytle. She holds her license in the District of Columbia, practices virtually and in New York City. Originally from Canada, Dr. Millie earned her undergraduate degree from the University of Toronto, her doctorate from the Canadian College of Naturopathic Medicine, and her master's in public health from Hamburg School of Applied Science in Germany. She is a published researcher, avid public speaker, and author of Eating for Meaning. She is a director of Nat Med Coach and the host and curator of Virtual Health Club, providing supervised self-care to help you stay out of the doctor's office. She sits on the medical advisory board for the School of Applied Functional Medicine, which is where I went to school and still continue to learn through them, and is a practitioner with Nutrametrics. Dr. Millie specializes in helping those address chronic fatigue and mind-body spiritual well-being. Thank you and enjoy this episode. Dr. Millie Lytle, welcome to the Rebel Health Coach Podcast this afternoon.
Thank you, Tom. It's great to be here.
It's great to have you. We've been talking about this for a while and it finally came to fruition, so I'm happy about that. And today we're going to talk about a topic that everybody needs, self-care, but we're going to talk a little bit more into the role of self-care for the treatment of chronic disease, which before we go into that, I want you to tell the listeners a little bit about yourself and what drove you into becoming a naturopathic doctor.
Okay. Yeah. Well, we all have a personal story, I think, when we enter holistic medicine, especially when I entered school, it was late 90s. So it wasn't as popular as it even is now, you know. So I had been raised healthy on a healthy diet. My parents kind of lived a little bit off the grid, and so to speak. Like, we had an organic garden and we composted, and none of this stuff was trendy at the time. And so I kind of grew up in a household where my parents fed us, you know, based on Adele Davis. She was a nutritionist in the 60s and 70s, kind of came out of the hippies movement.
Okay.
And so I think that really impacted me as I was growing up. My parents made their own bread and sold it, very dense, you know, natural peanut butter we ate from the health food store. So all of this really did influence me, maybe without even me knowing. And then when I went to college, I moved away from home and I kind of was immersed or inserted into mainstream food and culture, I think, for the first time. And by the time I was 20, I had like a chronic viral health condition. And so that came on. I mean, I guess I'll just be completely transparent. I had HPV. I had a very severe case of HPV, which was bordering on cervical cancer. And I was only 20 years old. And at the time I was in college. I was doing my undergrad, but I was working as a juice bartender. So I was, you know, making carrot juice and stuff and serving it to people. And there was a naturopathic medicine clinic in the back. And I was working with, there were naturopathic medicine students on the floor. And there was a vitamin store there. So I was kind of in this one-stop clinic, shopping depot, juice bar, without really knowing anything about what was going on around me, other than the fact that I was making healthy juice and just having fun doing that and drinking juice and being in college and everything. But at one point I revealed my diagnosis, and one of the naturopathic medical students said, there's this naturopathic doctor, her name is Tori Hudson, and she has a protocol for that. And that's actually an STD, which wasn't even revealed at the time that HPV was the cause of cervical cancer. So the medical system hadn't even kind of put those together yet, or that wasn't even being tested for. And so naturopathic medicine was the only place that I'd really had answers on that. And of course, the doctors wanted to do surgery, and they were even talking potential hysterectomy and all of this kind of thing.
Wow.
And so, and I was only 20. So I decided to try this really intensive vitamin protocol, which was tons and tons of vitamins. And I just took it religiously. And for 4 months, I think I was taking like 10 milligrams of folic acid per day and 100,000 international units of vitamin A, and even like levels that I don't even recommend that to patients, because I don't think that we need to be on that high a level in order to cure it. But so all the antioxidants, A, C, E, selenium, zinc, and also doing some like brassica family green tea and broccoli family vegetables. And so that was the protocol. And so 4 months later, I went back and everything was normal.
Wow. Good for you.
Yeah. So I was like, wow, okay. Like they were talking hysterectomy and now they're talking, it's all better. And in the meantime, also, I never looked better. I never felt better. Like my skin was great. I kind of saw this like physical transformation for myself as well. I felt great. I felt great doing it. And I think that was when I first started feeling like belief that, and just this awareness that there is this other type of medicine and that it is something that I could potentially participate in. I mean, at the time I was studying women's health. I was studying from a sociological standpoint. I was studying film theory. I thought I was going to go into feminist theory, but I had, done the pre-med track. So I had all the credentials. So then when it came time, somebody just said, you could be a naturopathic doctor, and at the same place, at the same juice bar. And I looked into that. And then all of a sudden I was enrolling that. I was dropping out of a master's program and I was going to naturopathic medical school instead. So.
Wow, that's cool. Where'd you go to school at?
So I went to the Canadian College of Naturopathic Medicine. Okay. I grew up in Canada and I was living in Toronto at the time. I was at the University of Toronto and then I graduated from there and then I went to the Canadian College.
Okay, cool.
Mm-hmm.
Okay. Well, this topic of self-care is something that important to everyone, as I said earlier, especially those for chronic illness. And if we talk about chronic illness and disease, most of the people that get diagnosed with a chronic illness or a disease start going down a very deep rabbit hole of feeling very sorry for themselves and aren't sure where to go with it. And you and I both know that Dr. Google is a great tool, but it could also be a very vast wasteland of rabbit holes. And so this is a very important subject for everybody. But, with chronic disease, we have to watch it. So where do we start as a practitioners to help people with chronic illnesses or diseases learn more about self-care? And how do we get them started so that they understand it?
Yeah, that's a really good question. I mean, so it depends. As practitioners, we only see the patient when they come into us. So depending on what type of practitioner you are, right. You're a functional medicine health coach and I'm a naturopathic doctor. So honestly, by the time people generally come in to see me, they already have an entire team. They've already seen their primary care provider. They've already done all the Google searching. They might be years into their chronic disease by the time they see me.
Okay.
So depending on what type, whereas primary care providers, they're facing these symptoms from the very beginning and might have been trained not to even, might be trained to diagnose, but if there's no diagnosis, then they actually can't do this. And so this gap between like where patients start having symptoms, when they start having symptoms, and when they're ultimately diagnosed can be years in terms of some chronic diseases, especially as we're seeing, multiple autoimmune diseases or people are experiencing like symptoms of syndromes like leaky gut syndrome without having a real medical diagnosis. They can be caught in this void. So I think where practitioners can start depends on what type of practitioner you are, what niche you have in terms of your chronic disease patients, when they come to see you, ultimately, if you have a specialty or if you're just a generalist or you tend to get people early on or you tend to get people late in the game. I've always gotten people late in the game.
Okay.
And so developing a team is really important. Like, as a primary care provider or as even an adjunct care provider, you have to recognize that it's not only the work that you're going to do in your own practice that's going to help the individual. So it's not only about just giving them things or providing tools, it's also about extending to them where care is going to happen the majority of the time, which is at home, right?
Yeah.
And so there's been lots of research done on the fact that, for instance, clinics that acknowledge that it's not a top-down medicine approach to taking care of one's patient when it comes to chronic disease do better than practitioners who just try to take it all on their own. Because if you try to take responsibility for the entirety of your patient's disease, you're probably going to come up short. You really have to empower the patient, because a lot of it does come down to how the patient's behaving, how the patient's reflecting on their own symptoms, how much time the patient's responding and taking responsibility for addressing, their emotions, their physical symptoms, and how much responsibility and attention they're kind of willing to give it.
Okay.
Now, many chronic disease patients are willing to give it a lot of time and attention, but there's a sweet spot in there that I think every individual kind of has to find.
Right. Self-care is one of the things I struggle with a lot, but I do make time for it. Of course, I don't have chronic disease at this point, thank goodness. But it's hard to take care of. And I think, what is the role of a practitioner or a naturopathic doctor in self-care? And, it kind of leads off of that question a little bit. What is the role for us or you to as helping them move forward?
Well, the role of a naturopathic doctor is to support the patient's wellness, support the patient in growing their wellness, growing their health promotion, also developing a plan that's going to work for them in that they can address their symptoms as well as lead a healthier, better quality lifestyle, and address their mind, body, and spiritual aspects and needs. Help to guide the patient on where they're maybe falling short, what they need to work more on, and provide evidence as well as clinical experience that the patient can rely on, so that they're not just shooting in the dark, trying everything that Google says. That They're actually guiding them in a scientific direction and have them on a trajectory, a plan, because chronic disease is, in medicine, there's no cure for many chronic diseases, right? Whereas in naturopathic medicine, we think that there is reversal of chronic disease, and we see that.
Right.
Because once we implement a lifestyle plan that maybe the patient's been avoiding sleep, for instance, like lack of sleep probably is the number one negative behavior that chronic disease patients all across the board exhibit, is not going to bed before midnight, maybe never have, maybe not being able to sleep as children. And that can also, feed into traumas and things like a negative experience that the person has been through childhood or through adolescence so we want to correct those behaviors that are just not working for the patient in a scientific and supportive way, not in a judgmental way either. Yeah.
And I think, one problem with society today and sleep that I see is a lot of people sit on their cell phones as they're laying in bed, wondering why they can't fall asleep. So I think, that's a good place I usually start with my clients is like, okay, put the cell phone in another room and plug it in for the night and charge it,
Yeah. I mean, we definitely have to address the basics of lifestyle.
Yeah.
How is this person sleeping? How is this person eating? How is this person exercising, or moving, how is this person interacting, how is this person pooping, right? Like these are all the basic physiologies, and the way that the body heals itself is by addressing these kind of basics and returning them to normal whenever we can. And then that's how we see reversal of symptoms, right? It's not a top-down approach I mean, definitely supplements help and medications help, but generally those are not the way out of chronic disease.
Right.
Yeah.
Is to keep, and that's something that I work on also is keeping in the parasympathetic mode versus the sympathetic mode, just the basics of getting them to relax.
Yeah. Stress management is such a key component. And so and stress is being driven by the lack of sleep, by how we emotionally deal, or how the patient emotionally deals with experiences, by how they eat, and how, even hunger being a trigger for stress, for instance. And so if we can help them, as you said, get into parasympathetic mode, or if we can help balance their cortisol levels, that's always a key. Assessing cortisol is always a key in terms of chronic disease management, because whether or not the chronic disease came from stress, cortisol imbalances, or years of chronic stress, or whether they're suffering from the stress of having a chronic disease, depending on how long they're living with it, it's always part of the picture. Absolutely always.
So one thing that I see with a lot of people with chronic disease and have chronic disease is they feel like they've been abandoned by the conventional medical system and giving prescriptions and just saying, okay, come back and see me in 6 months. How do you feel about that part of that?
Yeah, I don't think it's any secret that the healthcare system or conventional medicine doesn't address chronic disease well, or doesn't manage chronic disease well. I mean, here we are living in America, or even if you have listeners, from Canada or anywhere else in the Western, Americans die of chronic disease, right? The 6 most common chronic diseases are mostly all lifestyle related, generally in the category of preventable illnesses. And so with all the research and resources that medicine's putting into chronic disease, I mean, we can't even lower blood pressure effectively, right?
Right,
so,
exactly.
I mean, so absolutely, in terms of patients feeling that conventional medicine is not addressing their question. I mean, there's this missing silo of information between what medicine can do, which is basically they can assess, they can diagnose, they can examine, which is all great. And they can do that very detailed, very finitely, very acutely. And then they can basically treat with pills or medications or surgeries. And that's basically what they can do. And patients have so many more questions about, how did I get there? Why do I have this? How did this develop? And those are questions that, first of all, there's not time within a 15-minute appointment, within one's doctor's appointment, to answer that question. And that answer is, conventional physicians are not really trained to answer those questions. Why you got this?
Right.
We might know because of this genetic aspect, but whether or not that doesn't empower a patient. So I think patients want to be empowered. Patients want to feel like they have choice. Patients want to feel like they can do something to help themselves in addition to following doctor's orders. And so all of that is a massive gap between patients going to their doctors and doing everything the doctor says, even the very compliant patients doing what their doctor says, and still leaving feeling maybe abandoned or misheard or misunderstood. Or my patients talk a lot about just a lack of listening. They say that I'm the only doctor that will listen to all of their concerns, their whole story, because that narrative aspect of medicine, of healthcare, is so important. We're learning that's actually a discipline of medicine, or especially in research, that just the practice of telling your story is healing and therapeutic in itself, right? Because
absolutely,
Because people don't develop chronic disease for no reason.
Right.
And this is, I think, another thing that's missing in medicine is understanding all the social, maybe family dynamic aspects of, in addition to, oh, okay, you didn't eat properly, or you are predisposed to this genetically, or because you're overweight, or because you drink 50 alcoholic beverages a week or whatever, like all these
Right.
Yes, right? But there's always like a deeper, okay, why are you drinking 50 alcoholic beverages per week? And what can we do about this? And what can you do about this at home?
And I think this is where I really appreciate people like James Maskell, Jeffrey Bland, and Chris Kresser, some of the other guys, about pulling in the health coach community to help with the physicians. And I think that this is where I hope to see before I pass away, that there's this bond between, not where a doctor says, well, because I had one client, I asked her to get some extra blood work, and she was warned by the doctor, be careful who you're listening to.
Mm-hmm.
But I think we need to bridge this gap so that we can work together at this, because, I mean, a lot of people go home with a chronic disease, or let's take cancer, the big C for instance. Mm-hmm. You're diagnosed with cancer. Okay, you're diagnosed with stage 2 cancer, stage 3 cancer. You're breast cancer, and here's your options. But nobody is getting, like, to your point, getting to what caused that. I mean, what did you drink a lot? Did you, where are you eating a lot of sugar? Nobody gets to the sleep, the stress. Nobody gets to that point in the physician's office, because to your point, they only have, like we said, 15 minutes of time. Mm-hmm. So this is where your role and our role comes in as a health coach, to say, okay, let's dig deeper and find out what's causing this, so that we can help you and do the self-care that needs to be taken care of as you're progressing into and hopefully reversing the chronic disease.
Yeah. When I was in college and undergrad, I volunteered for the Breast Cancer Resource and Support Center in Toronto. And they were a phenomenal organization. I mean, they were supporting women and their families who had been diagnosed with breast cancer, answering all sorts of questions. It was almost like telemedicine, telehealth coaching at the time. I mean, health coaching didn't exactly exist at that point, providing all sorts of resources, where you could get more support, where you could find out about genetics, what testing, further testing that you could do. But their huge hang up was avoiding asking patients why this happened. What could you have done in your life that contributed this? Because they were very sensitive to the blaming the victim. And so we also have to identify that when we're asking these questions about what we did do, it's not to judge or blame the victim, right? It's always to say, what can we do differently to move on to facilitate healing?
Right.
And that's another area that, doctors are not trained in behavioral medicine. I think they feel a loss, of conventional practitioners feel a loss, unless they actually are therapists, to counsel or coach patients on how to make changes in their everyday life, because that's not something that that's not something they're taught. Right. And that's something that health coaches are expert in, and holistic physicians as well. We know how to go down that route to facilitate behavioral changes in the patient without blaming them, but to facilitate the positive changes that can result from identifying and addressing those negative behaviors that could have got you to this place, that you can either simply, or maybe not simply, maybe it's a long term to go, to change that habit. But at least it can be something that's in the works.
Right.
So, and there's even research to show that it's not only doctors that help people, like, because this aspect of self-care is so important. And again, most health happens at home, because this is where people spend most of their time. Or you could say most healthcare happens at work, or most detrimental aspects of health, because this is where all the stress happens at work. It doesn't happen in the hour, the 15 minutes that you're seeing the doctor.
Right.
And it might happen with the management if you're compliant. And this is where, a lot of research is, okay, aspects of self-care are like, how compliant are you to your doctor? Do you get testing? Do you get vaccines? Do you get pre-screens? Do you get you take preventative medicine to avoid it getting worse, right? But it's like from where we're sitting is like, no, how do we promote our health? How do we change those behaviors on an ongoing basis? How do we deal with stress? How do we get to sleep better? How do we eat better? How do we inundate our bodies with superfoods and nutrients that are going to reduce that inflammation and heal that gut? And so this silo of holistic medicine, whether you want to call it functional medicine, naturopathic medicine, natural approach to healing, is a massive missing gap from literature that really concerns me, because patients are not being given this as a valid option at their doctor's offices, oftentimes, that they can actually use in order to learn how to do effective self-care.
No, you're right, 100%, because it's not even addressed normally in the doctor's office.
No, I mean, it might be addressed in terms of, they might ask, how are you sleeping?
Right.
How are you eating? Do you eat vegetables? Do you poop once a week or something? But like the range of normals, and then whether or not the doctor engages in those answers, right? You can ask the question and then receive the answer, but do you engage in those answers? That's what we do. And we have been taught to engage in those answers and to facilitate those changes. But then it's still up to the patient to do it on a daily basis. The patient still is the one that has to do it, right? We can't live the life for the patient. So these are all the details that need to be addressed and considered in the treatment of chronic diseases, self-care for chronic disease treatment, prevention as well, but treatment.
Yeah, very true. Very true. I think that's very important points. And so where do we start with self-care? What are some of your where do you like to go with self-care with somebody with chronic disease? How do you find out which direction to go with them and what self-care to apply?
So it's always individual, but it is about an assessment, doing an assessment as to what they're doing currently.
If anything.
Yeah, if anything. Most people, yeah, it's true. Most people who come into my office are doing a lot, actually.
Okay.
But certainly listeners at home, or we all might know people who are really not doing much other than just following doctor's orders, and they've maybe never had an awareness that it's an option, that they could do something proactive to help them, with their AFib or with their cancer or with their arthritis or something, other than just do what the doctor says. So that is really important. This is, exposure to the concept that self-care is not just going to the spa and applying, doing your nails and getting your hair done and all that kind of thing, right? That the self-care is actually, the purpose of self-care is to help the individual initiate daily activities that is going to reduce symptoms and improve their quality of life. There's actually a health benefit with it. So we assess what the patient's doing, how often they're doing it, whether it's having an effect. I generally tend to also ask, why they chose that thing. Was it recommended by somebody? Did they read it somewhere? Is it working for them? How do they know it's working? And so we want to just have a general picture of, in terms of all the aspects of the self, which are emotions, relationships, physical, daily routine, which is, nutrition and exercise, workload, stress levels, how they cope with stress. So we just ask about all of these aspects, making time for themselves, sleep, just all the things we've talked about, how long they're spending, if those hours that they're spending or minutes that they're spending doing that are effective, and where the gaps are, what they're not doing at all. And of course, if somebody's eating a perfect diet, or if somebody, removed gluten a long time ago and removed dairy a long time ago in their diet, then we're not going to spend a whole lot of extra time on the diet. Maybe their diet's great, Right. And so then we have to turn the attention to the next thing and to the pain points, the points that really are driving those cortisol levels out or driving that inflammation level up, so we can do a series of testing also based on what their symptoms are. If we suspect that there's GI issues, if we suspect there's hormone issues, if we suspect there's nutrient deficiencies, or even what shows up already in the blood work that's been done with the doctor. And you have to prioritize. You have to prioritize what to do first, what's going to generate the most change early on for the patient so that they can see results of their changes in behavior. but also what's going to affect the disease process in the long term, right? So as a practitioner, you have to make those decisions as to treating the branch and you're treating the root all at the same time. And it's going to be something that's manageable for the patient. So I do also tend to start with, I'm trained in cognitive behavioral therapy and psychodynamic psychotherapy. And I do tend to follow this, do what's easy first.
Right.
When it comes to self-care, because of the list, let's say we assess that, okay, you need to increase fiber. We need to get you pooping. You need to increase water and you need to turn off your screens or you need to sleep better. How can we facilitate these changes? And then you ask the patient, what would be easiest for you to do? What do you think you'd be able to do successfully? Because you also want to empower a patient, especially with self-care. Like self-care should actually feel good to the innocent part of the person. So I like to say that self-care, you do it for the 4-year-old self inside you. You do it for the innocent part inside you, because there's always ways to do things that are fun or naughty, or there's always ways to get pleasure, right? Self-care is not just about pleasure. Self-care is actually about taking care of that innocent part of you that may have been neglected or may is not being addressed in your daily life right now. They got pushed out somehow.
Right.
Yeah.
I like that. That's really good.
It's very gentle. It's very unalarming. And not every style of coach is like this. I also appreciate coaches that are like, you do this and you be accountable in this way. And I'm going to do this and I'm going to check in every day. And I think that's great too, because a lot of people actually do need a lot of accountability. And I do provide that as well. But you can connect the person with the aspects of themselves that they're neglecting by asking them to tune into that part of themselves that is more childlike or more innocent or quieter. Because it's all about, ultimately, you do want to, it's like, I don't want my patients to need me forever. Honestly, I don't. I want my patients to take the tools that I give them and for their body to go through the healing process and for them to be able to manage it themselves, right? You don't want to be indispensable to your patient. Right. I mean, maybe it's bad for business, but it's better for integrity in the long run, right?
Yeah, because you don't want to, if you keep something hanging over them, it's not a good thing.
No. And so you need it to click, right? You want it to click with the person, that what they're doing is benefiting them and that they know how it's benefiting them. And that it's not just because you're telling them that it's going to help them, that it's a benefit, but that they actually are feeling that as well. And so that's also where some of the time of self-care comes in, because that requires reflection.
Okay.
But then that's also a great way to put somebody in parasympathetic mode. So
is reflection,
meditation, quiet time, journaling.
Right. Journaling.
Yeah. So people can start to devote that practical time for themselves towards, even if they're just, reflecting on, is my disease getting better? Or am I feeling more limber? Or is my mindset improved? Or
now, you said do you do a lot of dementia stuff?
I do deal with, I wouldn't say I deal a lot with dementia, but I definitely do work with people who have memory loss. I mean, depending on the age of my patients tends to be between 30 and 65 years old. Okay. That's the majority. And so I think, people who are dealing with seniors probably work with dementia a lot more than I do. But memory loss is definitely a side effect of any chronic disease.
Right.
Lack of focus. People think that they're getting dementia. I have a lot of patients who think they're getting dementia. I end up doing mini mental status tests or mental status tests on patients because they're so distracted and they're so stressed out that they can't remember things properly. So we definitely work on improving memory. That is definitely part of self-care. That's a good outcome, actually, is that people can focus better.
What kind of tools do you use for that? Do you, I with my mother, I have to do puzzles and stuff to keep her mind focused on something, like just moving different shapes around, or coloring. I got her a coloring book too, so she can practice that.
Mm-hmm.
Is that some of the things you do for the memory or okay?
Yeah. So you play games. You do have surprises. So maybe not huge surprises, depending on how fragile the patient is. But you want to, suggest a different route home or throw them off course somehow with a joke. It's the unpredictable events in the day, but also reduction of screen time, because studies show that watching television is a way it programs the brain to expect the same all the time. And the more hours people watch of screen time, the less smart they are, because they're always anticipating the same result. So less screen time is definitely better for more reasons than just sleep.
That's right. Yeah.
Yeah.
Yeah. I haven't. I don't even know why I have a TV. I never turn it on.
Oh, that's good.
Yeah. Except for football season.
Right. Okay.
And now for a little general housekeeping. If you are enjoying this episode, I'd greatly appreciate it if you would go to whatever app you are listening to this on and rate and review the show and share it with your friends. Thank you very much. Now, if you've been listening to my episodes for the last couple of years, you'll know that I key on gut health quite frequently in my episodes because honestly, gut health is king. And pretty much all disease begins in the gut, as Hippocrates said back in 420 BC. So that's a reason I key on gut health quite frequently, because if you're trying to do something simple as just lose weight, your gut health is key. So I have been developing a gut health cheat sheet over the last few months for you to download. And you can obtain this gut health cheat sheet by texting the word gut health, 2 words, gut health, to 773-770-4377. Again, gut health to 773-770-4377. Thank you, and I hope you continue to enjoy this episode and make it a great day. Let's talk about some self-care tips and tools and where we can go and what some of the things are that we do, you do, or I do too. I mean, I've got some, like I said, the coloring book's one I always do for my mother and some of the older people that I know. But what are some of the things that you do in your practice, or some of the self-care tips for people out there who are suffering from chronic disease listening to this show?
Well, meditation, I think, is the most important. That if we look at society as to what society is not doing, especially, I live in New York, you live in Atlanta, depending on where people are living, we don't get enough time in nature. We don't get enough time away from stimulus. So giving the mind a break, going inwards, giving people that third eye experience. You go to the mind inside your mind to become more objective on your life. Because the sensation of stress, where we're feeling backed into a corner, we're feeling there's no choice, we're feeling like we don't have enough time in the day, we're feeling like we can't get everything that we need to get done. It's a type of, our point of view is too close to it's like we have to back up in order to see distance, in order to create distance. And that meditation, I think, is the best way to do that, to create space, time, objectivity, fewer thoughts.
Okay.
The goal is to create fewer thoughts. If we can create fewer thoughts, then more intelligence, we create more room for epiphanies and intelligent, self-driven thoughts that come from the wiser area of our own selves, which we all have. Because the other thing that I think is that about the importance of self-care is that a doctor, even a doctor like myself, as wonderful as I believe my medicine is not the answer to healthcare. I think that I personally feel passionate about the fact that each individual is the answer to their own condition. We all have that knowledge deep within inside ourselves. We know how we got here. And people generally tell us, right? Like,
Right.
If you see a patient in your practice, you ask them how they got here, they can tell you a timeline. It's like, well, I've always thought it was because of this. I always
Right.
had that accident. I always thought so. Nobody ever corroborated it. The doctor didn't think so. But I always thought, it's like, or I was never well since this event, or as soon as I took myself off of eating red meat, then all of this stuff happened. And it's stuff that seems illogical sometimes, right? Because people,
Right.
I'm doing a good thing by stopping red meat. And yet they don't stop to consider the fact that now they're eating chicken 7 times a week and that can bring its own inflammatory issues, right? So giving oneself the space for reflection is the single most important benefit that one can do for oneself.
Okay.
Yeah. That can come in all different ways. People can get that space, that meditation, that reflection in all sorts of different ways. And can be personality driven.
What do you do for somebody who has difficulty meditating?
There's so many different ways to meditate.
Okay.
And so, there's lots of apps now, Headspace, Calm, where it's simply, they take you through a guided meditation. So if that's good for people, they tend to follow instructions well, they can do that. It's also very easy because it's on your phone. You can catch 5 minutes away from work, at lunch, on a break, even at your desk if you're able to put earphones in or earbuds. A very simple way to meditate is simply to count your breathing. You simply count in for 5, you count out for 5, you count in for 5, and you count out for 5. And all you're doing is counting.
Okay.
So, people complicate meditation because they think they actually have to clear their mind in order to be meditating. And it's like, well, in order to be meditating, I have to clear my mind. So how do I clear my mind? It's clearing my mind that is clearly the problem. I don't know how to clear my mind. I'm thinking, you know what I mean? And so people drive themselves crazy thinking they're failing at meditation.
Right.
And
I'm one of those people, by the way.
And this is just perpetuating the excuse or the inability to calm the brain, right? Because you don't have to get rid of all the thoughts in order to be meditating. Meditating is the process by where thoughts slow down and our intellect gains control over our thought patterns. So thoughts come in during meditation and you just allow them to go out. Whereas in our normal life, if we're not focusing on our thoughts, then thoughts come in and then they lead us to another thought, and it leads us to another thought, it leads us to another thought. And oftentimes these are bad thoughts, right? Like, what if this happens? This happens. Oh no, this reminds me of when this happened and this happened that time and then this happened. And then along the way, you start getting mad at everybody and blaming yourself and beating up on yourself. And you kind of take yourself through this whole emotional and mental tailspin. Whereas with meditation, it's simply you breathe, you find that place, that third eye in the center of your forehead, that eye that's within your eye, and you focus on a theme, whether it's breathing, whether it's that you can pick a theme like a mantra, like I am good enough, I am worthy. Some people do that. Or you listen to music, you listen to Mozart, Bach, you listen to something that's kind of soothing, scientifically soothing. I wouldn't recommend death metal.
Yeah, Metallica won't work very well for
as much as I love Metallica,
right.
Not good for meditation.
Not for good for meditation.
No. Or you simply focus on a theme like I'm a traveler, I'm a guest in this world, I'm new here, I see the world with fresh eyes. And so you can think something else which is positive and new and refreshing. And even if a worry comes in, then you just work on allowing that worry to go out.
Okay.
Yeah.
Yeah. I mean, meditation is probably the number one in my book also. So, I mean, I don't do very well at it. I end up, I use a thing called the Huzo that I did an episode on, which is a human sound. And I do that for like 30 minutes twice a day. And it's just, it's pretty cool. It relaxes me. So, what else do you do? Let's go from meditation to the next. I mean, I know that walking's a good one for me. Being in nature, like you said, is a great one.
Yeah. Grabbing time in nature is, there's studies that show that forest bathing, right? They call it Japanese forest bathing, I guess is where it was first researched. But anytime you can get into nature and be intentional, and you don't even have to be deep in the woods. You can be at the park.
Right.
And you just get intentional with it. So you just, admire the leaves, the trees, the bark, the water, the fresh air on your face. It's kind of like about admiring, and it's also removing yourself from all the electronics, and there's that aspect as well. But nature is soothing because it's so fresh on our senses, all of our senses. It is like a bath. It's an immersion and all parasympathetic.
Right. That's awesome. That's
all beauty.
Yeah.
You can feel the sun, you can feel the wind, you can see the nature, you can hear the rippling, you can hear the leaves, and it's just a sensory vacation.
Oh yeah. I did that last night a little bit. I went down to the Chattahoochee River and just sat there and watched the water flow, and was actually praying about my sister. So, so that was I like that part I like the nature part a lot.
Yeah. And I think that is a meditation, because nobody has to do it all the same way. If you're able to calm your thoughts, take yourself out of the stress that you're in, the more we can do that on a daily basis, no matter what the tools are that we do, that's effective, because then that's going to give us those breaks of time that we're not overthinking, dwelling, working, stressing, focusing on the pain. People can also, especially people who have chronic pain, they can also, notice, like journal those things. Like, how do I feel when I'm in nature versus how I feel when I'm at home in bed even? Or how do I feel when I'm walking versus how I feel when I'm sitting at my desk? And purpose of journaling that is to notice, like, oh, I feel better when I'm doing this, and whatever allows you to feel better, you do more of it.
Okay.
So self-care is as simple as that too. It's self-care feels good. It feels good, as I mentioned before, on that innocent self, but it feels good on that part of yourself that identifies with less pain, less stress, less worry, more space. We all owe it to ourselves to give that to ourselves as many times per day as we can.
Right.
And of course, eating good food is also self-care. Eating regular food, good food, balancing blood sugar. That's also part of self-care that we haven't talked about.
Cooking could actually be thrown in there too. The actual making of a dinner could be self-care, because it's so...
Absolutely.
I find it comforting. I love cutting up stuff and put some jazz on and just go and start cooking.
Yeah, well, there's a Taoist expression, chop wood, carry water, right? Which is basically doing these mundane things every day. That could be licking envelopes, but chopping vegetables, chopping celery, onion, those are definitely these mundane chores. We could look at it that way, but then they are also meditative, reflective. Give yourself time to have contact with your food. It invokes spirituality, actually, because you can think about where the food came from and how wonderful this world is. And, those are all really important. Yeah. It's very, very simple. It's not like you don't need to have, I don't necessarily have a problem with like high-tech apps, but those are not necessarily the best path to self-care, right?
Well, I think one of the things of self-care is detaching yourself from the electronics.
Yeah.
And I think that's a huge part of self-care. And I know that there's some good meditation podcasts out there. A friend of mine, Shell Hamilton, has one called Meditation Minis. And so she self-guides you through a very less than 10-minute meditation.
Mm-hmm.
So, but you have your phone again. So I really enjoy not having electronic device around when it's time for me to unwind.
Yeah. Yes. Yeah. There is that fine line, or it's probably really not even that fine, between electronics or technology being used as a tool to improve ourselves whether that's for self-care or whether that's for learning, actually, because learning is also a very important element of self-care.
Oh, good point. Go on with that one a little bit.
Yeah. So when you're, if you think of yourself as a student of life, or if you're learning a new skill, or if you're setting yourself up to learn as opposed to being an expert all the time, or instead of being a dummy, like whatever you think about yourself and your internal thoughts, right? Learning something new is using a different part of your brain. It's being an explorer. It's being curious. It's increasing your focus, your confidence, and it's providing an elastic towards what you already know. So people who already believe that they know or have learned enough or are incapable of learning actually are more likely to get dementia, right? So it is a way to it is a way to treat chronic disease also, because by improving yourself, you also gain confidence. You gain rushes of endorphins, rewiring the circuit, reprogramming the brain. No matter what you can learn to be a computer programmer. You can learn to arrange flowers. You can learn to speak French. But anytime you're learning something new, you're allowing your brain to recircuit itself, use a different side of your brain, especially if it's something that you do other than work. Right. If you are creative in your job, then try to learn something analytical. If you're analytical in your job, try to do something creative. Because we tend to like relearn the things that we're good at and do things that we're good at. Whereas part of self-care is expanding our base knowledge and participating in studies or in skill sets that we're unfamiliar with.
Okay.
Yeah.
Okay. All right. So what's next on the self-care list? We've got meditation, journaling.
Nature.
Yep.
Food prep.
Food prep. I like the food prep one.
I like that too. And of course, eating. And so the food prep, to extend that into the actual eating of it, because then you have controlled everything that's in it. You know where your food came from. There's a full circle process in having the satisfaction of eating something and enjoying something that you've prepared. And also, it's just more nourishing. There's not extra salt, sugar, harmful fats in it that, you don't know what your favorite restaurant or takeout
place is doing. Yeah. Well, plus now that take it a little bit further, paying attention to what you're eating and how you're eating helps us with our gut health, which is ultimately the ultimate in charge of our disease. Gut, in my opinion, gut's a non-negotiable. So, your gut health is a non-negotiable. If it's not healthy, then we have all this chronic disease that happens. So if you're cooking your meal, then sitting down to eat it and enjoy it instead of shoveling it in, and then you're actually helping yourself there too. So the eating is definitely a self-care part.
Absolutely. Actually, I just had a new patient the other day who has anxiety and, diarrhea every time she eats. And I asked her in what situation she's eating. And every time she eats, it's both of her parents bickering with her about, what she's going to do tomorrow or what's, all of her daily plans. And she said, yeah, this is the time where we have our most argumentative conversations, or at dinner. And so we do have to think about food hygiene, not just what we're eating, how we're preparing it, but also just engaging again. The parasympathetic nervous system is required in order to digest food, right?
Right.
And so when we're actively engaging in conversation or arguments, or even if we're watching the television, or if we're physically running or moving, eating on the run, then our blood flow is not in our stomach where we need it to be digesting our food. It's actually elsewhere. Our stress hormones are raised, and we're not going to be able to digest the food, absorb the nutrients, and maintain the gut integrity like we would. Then we'll end up in like large pieces of food in our intestines, which is also promoting, inflammation, leaky gut, food sensitivities, all the rest. And you're right, the gut is the root to all illness. We mentioned sleep as being a main contributor and stress as being main contributors to chronic disease, but absolutely digestive health is the most important physical.
Right.
biochemical component to.
See, I see it time and time again, even with myself.
Yeah, every time. Mm-hmm.
You know, and
oh yeah, people who get autoimmune diseases. I mean, people come in my office just diagnosed with rheumatoid arthritis, and I ask them about their gut health, and they might not have had gut health for 20 years, but they definitely have had gut health problems like 20 years ago, where they were taking PPIs, antacids, had a period of their life where they were gassy and bloated all the time. And even if they don't have current symptoms, but now they have autoimmune disease, right? So
exactly.
This process progresses elsewhere. You don't always end up with the same symptoms.
Okay, what's next on our self-care list? We've got some digital tools. I know we talked about not staying away from the digital, but there are some good tools. You mentioned a couple of them. Headspace and Calm, 10% Happier. There's what's
Fitbit,
that? Fitbit.
Apple Watches. People are, any application on one's phone can measure their steps. MyFitnessPal for food. Fugicate is another one of those. Mm-hmm. Sleepio. I don't know what Sleepio is, but I think it helps. It measures how deeply you're sleeping.
Okay.
Well, Fitbit can do that too, and the Apple Watch too. I think like how many sleep apneas you have, and how many gaps in breathing you have. So there can be a lot of good information that's given.
And now they have a ring, an Aura. I think it's called the Aura.
Does that measure biorhythms?
I think it measures the same way the iWatch does. I'm not sure. I've really never dug into it.
It measures pulse.
Yeah,
maybe.
You put it on your ring finger, and I think that's where the measures the pulse.
Yeah.
So
it measures, so what your base metabolic rate is, how your heart rate goes down while you're sleeping. So all those tools, and like the self-tracking, the biohackers and things like that. I mean, getting hyper engaged, right? In every aspect of what they're eating and how deeply they're breathing. But that is not necessarily evidence-based at this point. So just because we're tracking does not mean we're actually improving. And I think also anything that comes out of Silicon Valley is so app-driven or technology-driven. And so again, is it like bringing you onto the computer more often, or is it taking
away?
Yeah. Exactly.
I prefer to be taken away from it. When I'm going to get away. I mean, I think we all have worked. I mean, that's the other part is that even if we don't have a chronic disease or illness, we all get to that sympathetic mode a lot quicker than we do the parasympathetic mode for the most part.
Yes, definitely. Yeah, we're programmed to go there. We know how to over-respond and freak out. And
right. I mean, that happens. Today has been that way, Before we go today, what tips or tricks or things you like to leave with the listeners that we haven't mentioned yet?
Well, part of self-care is also having fun. So that's really important to make sure that you're laughing every day. And again, that's about those enkephalins and endorphins, those feel-good hormones, because there are ways to feel joy and not just have a lack of stress, right? Because sometimes we put it like, oh, you just have to reduce your stress. But like, well, what is reducing stress exactly? It's like having more joy. So how do you do things that make you feel connected, engaged, laughing, joking, pleasured? And sex is in there too, like how do we liberate and get oxytocin feelings? And, that can be also with a pet, with a child, spending time with a pet, a child, but any way that things that give us pleasure. Again, I would say in that innocent way, as opposed to in that kind of way that adults can be. In the innocent way, what gives you pleasure, do that more, because then you have a more fulfilling life, a better quality of life. And people who actually have chronic disease also need to focus on enjoying their lives. And there's a lot to adapt to when you have a chronic disease, especially if you have a new diagnosis or if you have an ongoing non-diagnosis, but you have a series of symptoms, because then the aspect of being chronically ill can be your entire life. And there is an emotional adjustment that's required to being sick. And even to having cancer, for instance, that you can be healthy and happy with cancer. You can be healthy and happy with chronic fatigue. And you can think of it as temporary, or you can think of it as, you can still have a positive and hopeful mentality that you are going to kick it, or you're going to get over it, or, this is temporary. And I would recommend that, but also in the fact that not holding off everything until I get better, or, I have to be miserable in chronic disease because I have chronic disease and I have all these symptoms. So it is really important to experience joy, to experience pleasure, to experience happiness, even when having chronic disease. And not to put it off, or put off things you want to do until you get better.
Okay.
That's a part of the balancing act that's so important. You have to live life now.
Exactly.
Which is not to say you want to push everything and overextend yourself and push it. That I'm just going to push on or persevere. That also can be a bad approach for people with chronic disease, because it might mean less sleep, or too much exercising, or over-exercising, or trying to do activities that one used to do when they were well that's not applicable anymore. So one also has to find new things that they can do that provides them joy, which may be the same things but toned down. Maybe yoga but not power yoga. Maybe yin yoga, or maybe going to Coney Island but not going on the roller coaster, going on the kiddie ride, or just like a toned down experience, or going out with your girlfriends or your guys, and not having alcohol, but like still going out. So like there might be a toned down way that you can engage in things that used to be fun, or finding fun in new things, maybe new skills, or new experiences, new groups, new support systems with other chronically ill people also can be important. So,
that's a good point. I didn't think about that. Like groups of people in the same boat.
Yeah, expanding. Yeah,
sharing some positivity instead of negativity about they're all here in the same group. Yeah, that'd be good.
Yeah, exactly. And you have things in common with people automatically. And I mean, this is why I think chat groups are important, but this is also why I formed the Virtual Health Club, is so that we can have a safe space to talk about, disease prevention or disease management. We can learn, we can be educated, but we can also, have fun and share.
Right.
And, I think that's really important. I think it's important to devote time and conscientious time to not only the disease, but also experiencing a good life with the disease. So it does require changes in mindset for people. And there's no negotiation about that it does require people to change their mindset and to rethink about how their life is in the present. But that's valuable, because then it allows you to work from the place that you are now.
That's awesome. All right. Tell us about the Virtual Health Club and what you've got a couple giveaways here today.
I do. I have one giveaway. So if they go to the self-care assessment link that I provide you, natmedcoach.com/self-care assessment, then you can go through a questionnaire where we look at how well you're doing in your emotional, your relationship, your physical, your work life in terms of balancing your self-care. And then we'll send you a self-care gift based on your answers. We'll send you a tool that we believe that you would benefit from.
Cool. Okay.
And so be prepared for it to be different than what you're already doing. And so, because that's part of the deal, right? You have to get better in different aspects of self-care. And also I do have a weekly self-care club. And every week we offer different coaches and functional medicine practitioners, naturopathic doctors who are coaching on different aspects of chronic disease prevention and treatment. And people sign up on a monthly basis, and then they get access to the replays afterwards, unlimited for 30 days. And then we have other tools and tips and self-care in the news, and we're growing and expanding. So people who are your listeners can register for a month for 20% off if they use the code REBEL20.
Okay.
So they can just register on the website, natmedcoach.com, and use your code REBEL20, and then they'll get 20% off. So that's saving about $12. So it goes from $59 to $47.20 about there for their first month. Yeah.
Awesome.
We'd love to have people come out and try it out.
I'll definitely put that in the show notes. I am a member. somewhere.
You are a member, yeah. Yeah, and we call it supervised self-care because we want to help people do the self-care that's going to be the best for them.
Right.
There's tons of things out there as to what you can do, what you can try, but we're not only providing technology, we're also providing counseling, peer mentorship, doctors, supervision, so that people can ask questions. They can come on a couple times a month and, get answers to their questions about their supplement regime or their nutrition regime or what they need to do more of, as well as getting these content-based workshops.
Okay, great. One question I have before we go that I didn't tell you about. If you had 30 minutes to an hour to sit and relax, what album or artist would you choose to listen to?
Oh, this might be changing.
Okay.
It's always been Enya.
Enya?
Yeah.
Okay. Why is it changing? I'm curious.
I don't think she makes music anymore. And so I've listened to her sail away so many times that it's just maybe not doing it for me anymore.
Okay. Fair enough.
These days I'm listening to space-based binaural beats. I love binaural beats. I find they're really effective, and I feel like with kind of space themed kind of electronic music, that's what just allows me to separate from myself almost instantly and have that kind of
that's cool
experience.
Yeah, that's one thing I like about the Uso is it's monks chanting, and it's also guys on didgeridoos, and they combine it. So it's like it's not binary beats, but it's like this a weird vibe sound that you listen to for 30 minutes, and it just puts you in this whole different world.
Yeah. So, I love the trance experience where you can just I've been hypnotizing people and myself for a long time, since 2006. Yeah.
You self-hypnotize yourself?
Yeah. Yeah, it's a tool that I've used for a lot of my life. Although, and actually, I was always less into meditation and more into hypnosis, but now I'm actually into the process, because with hypnosis, you kind of go directly there. You're just you facilitate the theta waves or the brain waves that you kind of want to get to. Where that place is when you're experienced with self-hypnosis, and you just go directly there. Whereas with meditation, you actually go through the process of getting there, of slowing down the brain waves. And these days, I'm liking that more. I'm kind of liking the journey, I guess, instead of the destination, you can say.
Cool. Very cool.
Yeah.
Well, thank you for coming on the show today. I appreciate you, and I hope to see you soon. I don't think it will be this October for the retreat, but I'm going to get up to New York, and I think I was going to get together with Dr. Selassie when I got up there. So maybe all three of us could have coffee somewhere.
Yeah, that'd be great. Yeah, let me know, either in Brooklyn or the city.
Yeah, it'll be in Brooklyn area, or she's not in Brooklyn, so we might have to go
She's in
figure it out.
Brooklyn.
Yeah, she is in Brooklyn?
Yeah, she's in East New York, but yeah.
Okay.
Yeah, she's far out,
Far out of, okay.
She's on the East New York. But
I'll be in the Park Slope areas where I'll be staying, so.
Oh, yeah. Yeah,
we can always
meet there.
Yep, or we can go to take Ubers.
Yeah, absolutely.
So, all right, thank you very much.
Tom. Yeah, thank you so much. I really appreciate it. I hope you got some good stuff.
Oh, it's good. It was awesome. I enjoyed doing these with you.
Yeah, thanks so much.
Thank you for joining in today with the Rebel Health Coach, Tom Underwood. And be sure to subscribe to the show so you can catch all the episodes. With desire and commitment, you can implement a lifestyle of wellness and fitness. For the support, encouragement, and tools you need to be successful, visit tomunderwood.net.